There are four aims of MissionPoint. The first is improving the healthcare status of our community. If the quality of care and of outcomes doesn't improve, we have failed. The second is healthcare costs need to come down and the patient experience needs to improve. As it was articulated, we have huge fragmentation, we have escalating costs. We understand as employers ourselves that it's sometimes really difficult to understand why that premium went up or why that cost went up. And year after year for that to happen is a really difficult thing to endure economically at the very least. And so what we're trying to do is MissionPoint is to sort of build that bridge with employers, and we want to have you come to the table and be a part of that conversation with us directly. And the last is enriching the lives of caregivers. We have worked with many physicians as we've sort of designed this system that we'll be describing, and it's clear that many of our physicians want a different type of care as well. That the fee-for-service world has put them in a certain practice behavior that's difficult. And so one of the things that we'll be doing as MissionPoint Health is deploying care teams. These are people on our staff who are dedicated to the populations we're serving to make sure nothing falls in between those gaps. They sit as a backstop, being able to answer questions around where should I go for certain care, how should I respond to a certain diagnosis. One of the things we're most excited about is the advent of the home visit. We know that outcomes significantly improve if you do a home visit for that asthmatic child, or the grandmother who just fell and has a hip fracture. By entering into the home and partnering with patients, which is an inherent part of our model, we think we can really improve those outcomes and deliver new types of care.